This is All India Radio, Bangalore. Hello, dear listeners, and welcome to our program of English Talks. I'm Rosalind Matthew. This evening we have Dr. Pallavi Wajapey, Head of Department of Pediatric Physiotherapy at RV College of Physiotherapy. She has received an international award for Outstanding Researcher in the field of physiotherapy in the year 2018 by RULA. Let's listen to her as she talks about autism awareness and acceptance. Welcome, Doctor, to this program.
Hi everybody, this is Dr. Pallavi Wajapey from RV College of Physiotherapy.
How do children with autism spectrum disorder deal with social skills?
For children on the spectrum, they are going to have issues with social language and communication. They are going to need support from special educators, child psychologists, behavior therapists to work in the area of social language and communication. They can feel, they understand what you're saying. They need love, they understand emotions. I was reading through a publication in 2017. This was done in the UK. About 50% of the teenagers on the spectrum were dating when compared to 70% of neurotypical children. That means they were into relationships. The only problem was they had a lot of breakups because they were not understanding facial expressions or flirting. And the problem was they were not able to communicate. See, they require you to tell them everything in detail, speak out completely. They don't understand subtle signs. So that is why a lot of them could not maintain their relationship. But that does not mean they did not start one. So it does indicate that social interaction is something that they can carry on. I was also seeing one TEDx talk. The speaker was somebody diagnosed with autism spectrum disorder. So she was talking about an experiment wherein they had people with neurotypical development in one group, and they had another group wherein they had a mixed population of people with autism and people who had neurotypical development. So they played this Chinese whisper, you just whisper something in somebody's ear and then, they pass it to the others and the last person says that out. So in that experiment, they found out that people who are all autism group and people who are all neurotypical group did really well. Whereas the group which had mixture of neurotypical and autistic people, they did very bad.
Okay.
Because they were not able to understand each other at all. If you put all people probably with high functioning autism together, they will be able to gel up well and they will just find a way of communication. You put them with neurotypical people and there are problems because you have a set standard. You cannot talk loudly in a funeral. You cannot, laugh. Whereas these people will not understand all those social norms. For you and me, we have a social map. All through our childhood, we have seen situations and we have put things on those maps. And one fine day, we start following that map and living with it. The problem with children on the spectrum is they don't have a map. They are just on the go. They are picking things and they're not putting it on the map. So they don't know at what situation what has to be done. That is where social skill comes into issue.
Why do children with ASD become oppositional or they appear to be oppositional?
All teenagers are oppositional.
True.
ASD or not ASD. So there is no known clear cause for oppositional behavior. A lot of times what happens is when they get no for an answer, they want to oppose whatever is being said. But then there is a condition called oppositional defiant disorder, ODD. And this has been defined by DSM, that is Diagnostic and Statistical Manual. And they have said that children on the spectrum have higher chances of having ODD. They also have higher chances of ADD, that is Attention Deficit Disorder, Attention Deficit Hyperactive Disorder. So all of that. So basically, when you're trying to say no, they become oppositional. And with the children on the spectrum, we are saying no to everything that they do. They are stimming, we say no, don't do that. Stimming is self-stimulating behavior. So self-stimulatory can be sitting and rocking in a chair. It could be just closing your ears to the sound and going so you hear your own sound, white noise. Flapping hands can be stimming. Take a car and just turn the wheel and keep looking at the wheel and get lost in it. Or the washing machine's going around, they keep looking at the machine. Things that are rotatory or spinning or the fan. All of those are self-absorbed behaviors. Running, jumping, all of this is called self-stimulatory behavior or stimming.
Which helps to calm them down.
Yes, so it is shown to be beneficial for those children as far as it is not self-harm.
Okay.
But then we are stopping them every time. So in the class, if a child starts going, you're like, no, don't do that, you're disturbing the others. If he just suddenly stands up and starts walking, so you're like, no, don't do that, you go and sit back. So when we are opposing everything that they do, they have nothing else to do but to oppose us. So probably that is where it all comes. So the best thing for all of this is find out what can cause anxiety in them, find out what can cause release of that anxiety or release of that stress, and create that kind of environment. Exercise is the best medicine. Give them exercises throughout the day, which are planned and good for their health. So, they can have balance issues because they have problem with proprioception. Proprioception is understanding joint position. So when I sit, I know my spine has to be erect, right? But they will not know that. So they will always keep slouching because they don't know what is the end point of their joint. So getting them to be aware of their own body, getting them to be aware of their posture, giving them activities which involve stretch, strengthen. They will sweat it all and then they'll be calm. So when they are calm and composed, they can listen to a class if at all they are going to a school. When they're calm and composed, they can get back to work and complete the task at hand. Be clear about rules and boundaries. What is accepted and what is not. Sometimes oppositional behavior may be because of neurodevelopmental issues, and it might not be just them opposing everything. So if at all it is neurodevelopmental issue, then a psychologist is the best person to help. Also, you can have code words like it is a fidget time. You know the fidget toy? It was a stress buster. They're round and you turn one side and it keeps spinning over and over and over again.
Okay.
There were chewy tubes. All of these came as therapeutic measures for children with attention deficit and for children on the spectrum. But slowly they gained popularity, and now you have fidget with 3 spinning wheels and things like that, which has become a toy and every single child has it. But then providing such small escape routes can bring down these kind of behaviors because they are not able to concentrate on a 45-minute session. They need to break loose. So they will just turn around and push the child beside them. So you are going to say, okay, this child has bad behavior. That is because they don't know what to do. They are not able to concentrate. Everybody else is looking at the teacher and nobody else is looking at them. So they just want some attention. When we had one of the patients like this, we had given him broomsticks. He used to put that in the desk and break it into small pieces.
Okay.
So he was not disturbing anybody. Meanwhile, he was not paying attention in the class, because he had got his break. One stick is done and then he'll look up. So that feels new information to him now. So he'll get back to concentrating on the class. So we had to find out these Indian jugaads because there was no fidget toy then. So chewy tubes, we could give them those. You can give them a bubble gum in fact. So they can chew a gum and that will take away your mind from where you are right now. So you don't get up and disturb the entire session, but you still take your mind off and then you get back and it feels new information.
Is a mother's input a valid consideration in assessing a child for autism spectrum disorder?
Definitely. The mother, parent, guardian, whoever is with the child for the most in the day, they are going to be the first people whose input we are going to take when we assess for autism. During the growing phase, if the child does not like to be carried, does not seek for attention, or looks at spinning objects, sits all by himself and plays, is not aware of parent moving around, all of these are the first signs which only the parents will pick. It is only when the child goes to a play home or a school that the teachers will notice a difference. In those first 3 years, it is the parents or the guardians who are there with the child who are going to notice all these non-typical behaviors and report those. Most of the scales that we use for assessment, the first one being MCHAT, that is called Modified Checklist for Autism. That scale has few observable components and few components that we have to actually get the child to perform. In India, we have a scale called Indian Scale for Assessment of Autism, ISAA, and then there is Autism Assessment Scale. So there are multiple scales which are used to assess autism. See, no MRI or blood test or any lab investigation is going to tell you about autism. There are going to be these psychological analysis and checklists. If they fail on those checklists, then they are diagnosed to be on the spectrum.
And how long does this test take?
Quick tests, about 20 minutes.
Okay.
But then they are not detailed analysis. So they are just going to give you parts, bits and pieces. We can have detailed analysis that goes up to 2 or 3 hours, wherein every single aspect is tried and tested and noted down, and then a final diagnosis is given. And again, it is not going to be one test which is going to diagnose the condition. You would have to have multiple tests used, and then you will diagnose a child to be on the spectrum. Even in that, you will have mild, moderate and severe types. first person to come in contact with the child is going to be the parent. So parents' report is going to be very important for us. We had this one mother who just noticed that the child was continuously flapping hands. That was the only thing she noticed which is different from other children.
At what age?
She noticed this by about 18 to 20 months. It's a very young age. But then we were able to diagnose that the child is on the spectrum at that age because the child showed those features and the parent could identify that. This COVID phase has been very bad for a lot of people because it involved the child staying at home, attending online classes. The only people the child spoke to were the parents. So a lot of cases went unnoticed because they are comfortable with 4 people and the child is with those 4 people. If that child had gone to school and behaved in a different way, at least the teachers would have noticed the difference. But then with online schooling and children staying just in those 4 walls, they were already isolated and autism, auto within themselves. So they kept playing by themselves. The parents were very happy that the child is engaged. But then the diagnosis got delayed. So COVID has been bad.
Can you talk about the speaking style, such as focusing on certain topic that people on the autism spectrum disorder have?
When it comes to speaking and skills, there is something called as echolalia that they usually demonstrate. Echolalia is echoing whatever is spoken.
All of them do that?
Not all.
Most of them.
A lot of them do it. There is also something called as pronoun reversal. So, I had this one kid called Tanu. So, she would say, Tanu swing. That means she would not say, I want to swing or I want to go play that. So she would just use those 2 words. Sometimes she would say, you want ice cream, to say, I want ice cream, because that is how they speak to her. So she doesn't know who is you and who is I. So they have pronoun reversal. They can have part or full echolalia. So just one word could be echoed or the entire sentence could be echoed. There are a few studies which are saying that echolalia is a form of communication. So they are trying to converse with you, but they don't know what to say. So they are saying whatever you say so that you respond to it and then they can get that response. So sometimes echolalia can be good, but sometimes it can be frustrating even for us as therapists. When these songs came in like Dolare, so we had this kid go Dolare entire day. Because that was a repeated thing and she picked that up and she liked it. And then there was this kid who said, Sadda hak, ithe rak, Sadda. Would say that all day long. We had a 45-minute session in the morning and 45 minutes in the afternoon. You'd have lunch, come back and still keep saying the same thing. You try and get him off from that, ask him some other question. He'd answer that and go back to Sadda hak, ithe rak, because that keeps, going on and on in their head. So they can have echolalia right now. They can have delayed echolalia. It can stay for 2 days, 3 days. And after that, they will start saying whatever, you had said. So they can be probably good witnesses in the court because they would remember everything that is said and say it that way,
Okay.
But then they have pronoun reversal. They have echolalia. They have certain things. Probably they are their own way of trying to get into a conversation because they don't know how else they can do it.
As we end this conversation, what is the role of society towards people with autism spectrum disorder and how should we behave?
Awareness is basically knowing that something like this exists. Acceptance is letting them be a part of you, your society, your projects. We as a society should now start considering them as a part of the society and not looking at them as mentally retarded or mad people. They just have different ways of life. They also have fun. They can love, they can care, they can understand. Autism is not a disease or it is not something that will spread on touch. So accept those children. They may not respond to you the first time you talk because they have a problem with social language communication and behavior. So give them another chance.
Thank you, Dr. Pallavi Wajapey. That was very informative and encouraging. Dear listeners, that brings us to the end of this edition of English Talks. With us was Dr. Pallavi Wajapey, Head of Department of Pediatric Physiotherapy at RV College of Physiotherapy, and she was talking to us about autism awareness and acceptance. Till next time, this is Rosalind Matthew signing off.